On this episode of 26 Minutes with Dr. Warren Seigel, we're joined by Dr. Abdo Kabarriti, a leading expert in men's health. Together, we will delve into crucial topics affecting men's wellness, exploring cutting-edge research and practical advice. Tune in as we discuss the essentials of maintaining optimal health and well-being for men in today's ever-changing world. Welcome to the show. I'm so excited to have you here.
Thank you. I'm so happy to be here.
Thanks for joining us. So tell us a little bit about yourself. Where are you from? Where did you train? How did you get involved in this?
Of course. So I was actually raised in Brooklyn, not in the surrounding community. I went to med school at Mount Sinai School of Medicine, and then I did my urology training at the University of Pennsylvania. And then, of course, I wanted to come back home, and that's what brought me back to Brooklyn.
So you're trained as a urologist.
Correct.
Can you explain what a urologist is?
Sure. So as a urologist, we focus on everything, from the kidneys, the ureters, the bladders, the prostates, testicles, penis, kidney stones. So we treat a lot of different conditions, both in men and in women.
So your specialty now is specifically men's health. Can you talk a little bit about what made you decide that this was an area of medicine that just isn't getting enough attention?
Yeah, men's health is very interesting. It's a big term that encompasses a lot, and it's not necessarily just urology or urological issues when we talk about men's health. There's a lot of things, unfortunately, that it is well documented that men do not get or seek medical care as good as women do. In fact, in one study, there was about 40% of men said they don't even seek medical care until there's something very serious going on. Now, we know that has pretty significant consequences, right? The average life expectancy of men is lower than women. In addition, men are 40% more likely to die of these medical issues that some of them are preventable. And to me, that's what really excites me, and what I want to get the word out on is the importance of getting medical care, seeking medical care, even when there's everything looks normal, everything seems to be fine, because there's a lot of things that we can catch that could prolong survival.
So when I think of men's health and I think of a urologist, I immediately go to prostate health, and making sure that your prostate, you don't have prostate cancer. What other areas besides the prostate, what are the other parts of men's health that you talk about?
So when we talk about men's health, I think there's the medical aspect. There's also the mental aspect, mental health as well. I would put that under men's health. There's a pretty significant, about 40% of patients, men who actually suffer from depression at one point in their life, and I would say that's well beyond urological care. But I think that's equally important in terms of care. In one study, they actually showed that 83% of men report that they've had pretty significant stress within the last 6 months, or a pretty significant stressful event. And again, I think it's very important to have to seek that care and to speak to somebody about it.
But I would never go to my urologist to talk about being depressed or stressed.
Right, and that's not what what I would argue is that you don't necessarily need to speak to your urologist about that. And I'm not so sure that your urologist is well equipped necessarily to speak about that. But I think it is important to seek care. So even though I am as a urologist and I focus a lot of my practice on urological symptoms and diagnoses, I do, we are here to take care of the full patient, not just their urological organs.
That's wonderful. It's also, I really like the idea of men having a place to go. I mean, when we talk about women's health, everybody goes, yeah, I'm going to go to my GYN, and they met their GYN when they were pregnant and they went into the OB-GYN. But men don't really have that kind of specialty. So do patients get referred to you by their primary care internist, or how do they seek a men's health specialist?
Right. So I think it really depends patients, most of the referrals that I get tend to be patients with urological symptoms or issues. So for example, erectile dysfunction. So even though it is often thought as of a disease of older patients, patients can get it at any age. Now, here are some of the things that are interesting, for example, about erectile dysfunction. Patients who are, especially younger patients who are diagnosed with erectile dysfunction, have a pretty significant chance of having hypertension, having cardiovascular disease, having diabetes. In fact, erectile dysfunction can sometimes present itself almost 5 years before symptoms of hypertension present themselves.
Whoa. Let me back this up. So you're saying that a man who is impotent, cannot get an erection,
Right.
that can actually be a sign that they have a much more serious disease? Not that, I'm not saying erectile dysfunction
Right.
is that serious, but can actually be the sign or the symptom that they have something much more serious?
Absolutely, and I'll give you one mind-boggling statistic is in a younger man, that actually could predict the risk of having a cardiovascular event down the line. And patients with a younger patient with erectile dysfunction is more than 50 times, has a 50 times increase in risk of developing a cardiovascular event later on in life.
Wow, that's incredible. That's a staggering statistic. Can you define younger? The older I get, younger seems to get younger and younger. So what do you specifically, what ages are you talking about?
So we're talking about, men in their 40s, 30s and 40s, and even some men in their 50s. But I would say erectile dysfunction, regardless of age, is often a risk factor or can predict other causes as well, even in older patients as well. We're talking about patients in their 70s and 80s.
Oh, that's amazing. And obviously this is something nobody talks about.
Right.
I remember with my own kids being in the car and a commercial on the radio comes on about ED and my kids asking me, what is ED? I told them it stands for emergency department. But men don't want to talk about this.
Right.
I mean, it's embarrassing, it's a stigma, but you're saying that this is something that needs to be talked about early, again, to stay healthy. What are the other things that might be the reason that men need to seek your care?
I mean, there are a lot of other reasons. One of the more common things that we see is patients with urinary symptoms. Going to the bathroom too often, going to the bathroom, having urgency, feeling like when you have to go right away, feeling like you don't empty your bladder completely, waking up too many times at night.
Wait a minute, is this normal part of getting older?
But that's exactly the point. So everybody assumes it's just part of getting older and therefore dismisses it and never seeks, never see any their urologist or even the primary care doctor to discuss this. But again, a lot of these symptoms could be as a result of other medical conditions. So for example, patient with diabetes, if their diabetes is not well controlled, that's going to affect how frequently and how often they go to the bathroom. So we often have patients come in and their main complaint is, hey, why am I waking up so much? Is it because I'm getting old? But when we check their tests, you could even see some sugars in their urine. You could see or their hemoglobin A1C, which is one of the blood tests for diabetes, could be way, very, very high, right? So and that's how we often could make that diagnosis. So it's not only necessarily that, even though I'm seeing them for the problem with the urination, we often catch a lot of other symptoms and a lot of other things that are very important. And as controlling that diabetes will definitely add a lot of years to their life, even if they're not going to the bathroom as often.
Very interesting. I don't think of surgeons doing anything but surgery, but it sounds like you're making the case that there's a direct correlation between the medical care that people are getting, some of the symptoms that people won't talk about, and specifically men won't talk about. Do you find that they're more likely to speak to you because you are now the men's health specialist?
Absolutely. I think it's all about creating an atmosphere where they feel comfortable to talk about these things and knowing that, as a physician, I am comfortable talking about these things. And as a result, I think that gets reciprocated by the patient and they start to feel, more comfortable. And a lot of times, I think once they are in the setting, in the proper setting, that's when they truly, open up and actually can talk freely about their symptoms. As you mentioned earlier, there's often a stigma to a lot of these symptoms, so patients avoid, talking about that. And that's one of my most important goals when I'm having that conversation. Is I want the patient to be honest and forthcoming with this information, because we are not there to judge. We are there to help the patient. We are there to give them whatever it is they want, right? So as the other thing you mentioned is, people perceive surgeons as all they want to do is operate. And in fact, that's not, the case here, right? So whether we're talking about erectile dysfunction, whether we're talking about urinary symptoms, going to the bathroom often, most of the time actually, surgery is not even an option until we've tried several different things to treat these conditions. So a lot of times I try to go even with conservative management before I even go to medications. If that doesn't work, then we would go on to medications, and then surgery is sort of almost like a last resort in many cases.
So can you talk a little bit about what is a conservative management? You said before medication. What does that mean?
So a lot of times that's just kind of behavioral dietary modifications, right? So going back to the patients with diabetes, right? So a lot of times it's just making sure your sugars are controlled, making sure you're eating healthy, making sure you're exercising. For, again, similar, with the erectile dysfunction, the first thing I tell patients is, listen, you got to live a healthier lifestyle, making sure your cholesterol is controlled, your sugars are well controlled, your blood pressure is well controlled, making sure you actually are getting exercise there, and I mean cardiovascular exercise, not necessarily just lifting weights. To me, that's more, that's my first step, and that's what I want to emphasize to the patient, because a lot of patients, even though there are medications and medications work, again, there's a stigma to them. As much as we try to avoid that stigma, I try to avoid using the medications in the first place, if we could treat it just with behavioral and dietary modifications.
So assuming somebody is going to their primary care doctor,
Yep.
and they have diabetes, and it's a man, and they're on medications, isn't it true that a lot of the medications for diabetes causes erectile dysfunction?
So that is true for many of the blood pressure medications, that there are some side effects to those that could potentially cause erectile dysfunction. But by and large, making sure your blood pressure is controlled, the benefits of that outweighs the risks of those medications. And one of the reasons being is, the blood vessel that is responsible for erection is a blood vessel at the end of the day, right? So if you have high blood pressure, which means that that vessel is being constricted, and the blood vessel going to the penis is actually one of the smaller blood vessels, it gets affected first before some of the other bigger blood vessels. So if you have hypertension and that blood vessel is pretty constricted, there's going to be no blood flow anyway. So that's why it's so important to control the blood pressure.
Well, that makes sense. So that would be a good example of don't stop the medication for your blood pressure.
Correct.
Just so you could have an erection.
Correct.
I get that. That makes sense. And what about treatments for erectile dysfunction?
Right. So again, typically my first line is behavioral and dietary modifications. Now, if that fails, then we go on to the medications. But when we talk about medications, I have a lot of patients who come in, they say, I saw this online and I read this online. And I'm the first thing actually that makes me very happy, because I know that patient now has actually put in the time to do their research and has done a lot of, they looked at the different options to treat their condition. So actually I'm happy when I have patients who come in. The only thing is I'll tell them is be careful, because you don't know the quality of the information that is online. There is some information that is actually very, very good and very reliable. There are some information that is not very reliable. Interestingly, I've actually, on a separate note, I've done a lot of research looking at artificial intelligence as of late, and how how good the quality of that information is online. And it's interesting because there's some information that is actually great, but there's some information that I would definitely not rely on or completely inaccurate. As you know, there's a term in artificial intelligence called hallucination, where basically some of these artificial intelligence kind of make up something. So, so again, I'm happy that the patients are taking the time and investing in their care. But at the same time, I want to make sure that they are using reliable information. So typically, again, we try behavioral and dietary modifications. Then next thing would be to try the medications. But importantly with these medications, it's not about just using the medications, it's using them properly. And that's again where we sit for, go over in terms of how to use the medication, knowing what side effects to expect. Because a lot of times patients will say, I took it, it worked great, I was able to get an erection, but I had this side effect, and I was scared because the side effect, I thought I was going to die. So knowing what to expect when you take these medications often is very important, and it actually affects the how successful the treatment is. So
I'm still stuck on, you're having these conversations that it sounds to me like should be every man should be having these conversations with their primary care doctor. So far, I haven't heard any surgeon in you. Do you bridge the gap? Or
I do. So again, at the end of the day, we try these medications, but at some point, I'm obviously a surgeon, and I'm happy to do surgery for patients that need it and for patients that's going to help. So even though we try these medications, at the end of the day, I want what is best for the patient. So if these medications fail, then next thing, we're going to offer, there are surgical options that we are going to offer.
For erectile dysfunction?
For erectile dysfunction as well. So there are, different options available for the patient. But again, I'm not going to rush into it. But with that said, if I think it is befitting for the patient, then yes, absolutely. It's something that, we will offer.
Okay. I can't pass up this opportunity to talk about prostate health.
Yes.
I've just heard so many people that unfortunately have died from prostate cancer, and it just seems to be more and more prevalent. Is that true?
So the incidence of prostate cancer, which means how many new cases we have a year, is going up, right? If you look at 2024, we're expected to have almost over 299,000 cases of new prostate cancer. Now, unfortunately, prostate cancer is also the second leading cause of death in terms of cancers in men. Over 35,000 men are expected to die from prostate cancer in 2024. So it is a pretty significant numbers, both in terms of how many diagnoses we make, how many patients are diagnosed with prostate cancer, and how many patients actually, unfortunately, pass away from prostate cancer. Now,
so are the numbers going up? And more people dying, and the numbers are just going up because we're better screening, but we don't have treatment? Or can you explain a little bit more about that?
Yeah. So here's the crazy part, right? Is that prostate cancer, if we do the screening early, has a 5-year survival rate of actually pretty close to 95 to 99%. So very high if you catch it early. The problem is when you don't catch it early. In comparison, when we catch a prostate cancer, when it's diagnosed after it has metastasized, the 5-year survival actually goes down substantially. It's in the 30s, 35%, according to the American Cancer Society. So that's what's heartbreaking, right? Is 35,000 men die of prostate cancer. But the question is, are these preventable deaths if we had screened them, right? And going back to what I was talking about in the beginning, it's very important to see your primary care doctor to get those screening tests. The unfortunate thing about prostate cancer is that most men are asymptomatic. The overwhelming majority of men are actually asymptomatic. And it's one of those things where symptoms only develop once the cancer is pretty advanced. So you cannot wait and rely on developing symptoms before you seek care.
So what are the symptoms? How would somebody suspect that they might have prostate cancer?
So unfortunately, most patients will not have prostate cancer, assuming it's a localized disease. And that's just by the way the nature the cancer forms. It forms in the outer parts of the prostate, which don't really cause any symptoms. Now, as the cancer advances, if left untreated, then it starts taking up the entirety of the prostate, and then at that point, it could potentially cause issues, to the bladder and cause some blood in the urine or difficulty with urination. But in the beginning, especially in the early stages, most men will not have prostate cancer. In fact, the only way we will catch prostate cancer is by using actually a very simple screening tool, which is called the PSA, which is a blood test, prostate-specific antigen. So it's a simple blood test that is used as screening. Now, to be sure, PSA is not perfect by any means. There's a lot of downsides to PSA, but it is the best screening tool that we have at our disposal at this time.
So a simple blood test could pick this up early, but I think you said earlier at the beginning of the show that the vast majority of men don't go to see a primary care doctor. So assuming they got through the door and went to their primary care doctor, in addition to their flu shot, which I always talk about, and their COVID vaccines, right, and their colonoscopies, should they get a blood test, this PSA?
I would recommend it, for the proper patients. Now, there's certain age criteria for this PSA. Unfortunately, right, it's a simple blood test, but unfortunately, nearly a third of men will say that they've never been screened for prostate cancer. Never been screened. Again, we're talking about a cancer that has over 299,000 new diagnoses every year and over 35,000 men dying of this cancer. A third of men have never had a PSA.
Again, why is that? Because they didn't see their primary care doctor? Or because the primary care doctor doesn't know about it and didn't order it?
No, I mean, the primary care doctor knows, but again, a lot of men are waiting till they develop symptoms. They say, hey, I'm fine, I'm urinating fine, oh, it's fine, I just wake up one time at night, it's not a big deal. So they're waiting for these symptoms that often will not develop till the disease is pretty advanced.
So that whole myth of, well, I used to get up twice a night to pee. Now I'm 4 times a night to pee. I'm just getting older. That could be an early sign that it could be prostate cancer?
It could be. Although a lot of times it may not. I mean, there are other reasons as to why patients wake up at night.
So it doesn't necessarily mean you have prostate cancer.
Correct.
But it certainly is a good excuse of why you need to see your primary care doctor.
And that's exactly.
Or somebody in Men's Health.
Or a urologist. Correct.
Yeah. Are there other things that you'd like to tell us? This is a show about prevention. We'd like our viewers to know how, specifically for men, how can you be as healthy as possible? Are there other things that you would say, if you're a man, no matter what age, these are the things you can do to keep healthy, whether you're in your 20s, your 40s, 60s, or 80s?
No, of course. So I mean, again, I think the first and most important thing is making sure that you're honest with yourself, right? Making sure you're eating healthy, making sure you are exercising, making sure you're doing what we typically recommend, right? So making sure you're not on the obese side, right? So I think there's pretty significant, almost nearly 40% of men 18 years and above are actually considered obese. And actually a staggering statistic, the CDC, which is the center of the CDC, actually says that 14% of men 18 years or above are considered in poor health. That's a pretty significant percentage that I think we could, should be close to 0%.
And does that put you at higher risk for prostate cancer?
Just being in poor health does not, but although there are a lot of risk factors. The biggest risk factor for prostate cancer specifically is the family history, age, and actually also race.
So family history, we're talking about my father, or we talk about uncles, or how far do you go in the family?
Right. So father and brothers tend to be the highest risk factors. But with that said, for example, if you have 2 uncles who've had prostate cancer, that's definitely going to put you at a significant risk, right? Multiple, your grandfathers on both sides have had it. So again, although that risk factor may be a little bit less because it's your grandfather compared to with your father or your brother, it's still a pretty significant risk factor.
And does that mean I should get my blood test more often, or what does that mean if I'm at a higher risk?
Sometimes it actually affects when we start the screening process, right? At what age we start this screening process. So in many men, we don't start till the age of 55. But in somebody with a pretty significant family history of prostate cancer, we may consider starting it a little bit earlier. The other thing is, as I said, the PSA is simply a screening tool. How aggressive you are with that screening tool, because that screening tool doesn't say yes cancer, no cancer. There are different levels of PSA. So at what point you trigger to do the workup may change if there's a pretty significant family history. So as a physician, you are taking all these, sort of data points and you're putting them together, and then obviously you're taking what the patient wants and what the patient desires in terms of the care that they want. You factor all these in before you make a decision as to what your recommendation is.
And you mentioned the PSA and other screening tests. Can you just very briefly talk about if your PSA is going up, what else needs to be done?
So if your PSA is going up, a lot of times we'll order an MRI, and we'll talk about getting a biopsy of the prostate. And that's really to evaluate, again, at that point, these are more specific tests to really figure out, is there cancer or is there no cancer?
But most importantly, it's important for men to know they need to go see their primary care doctor.
Right.
They need to stop being such a baby. We need to stop being embarrassed about
Right.
our bodies and realize that our doctors are our doctors, and they're there to help us. I want to thank you so much for what you do, and thanks for sharing some wonderful tips today.
Thank you. It's
Really
my pleasure to be
appreciate it.
here.
And that brings us to the end of our program today. We thank you for tuning in and learning alongside of us. For more information about our show, please call 718-510-2103 or visit www.zormed.com. Stay updated and engaged with South Brooklyn Health by visiting us online at www.nychealthandhospitals.org/South-Brooklyn-Health. This broadcast was brought to you by Brick Media in partnership with South Brooklyn Health. For now, stay healthy and stay well.